So today, only 1% of abortions are done in a primary care setting, only 1%. Yet 90% of abortions are medication abortion eligible, meaning they occur within the first trimester where medication abortion can be safely administered by any primary care provider, whether virtual or in person, an NP or an MD, to be able to give a patient access to safely terminate a pregnancy, either in a clinic or in the context of her own home. Yet only 1% of abortions are occurring in a primary care setting today. So why does that matter for women, and why does that matter for providers and employers, and why do we at TIA believe it's critical that we change that? So I mentioned this issue of abortion, of course, now being restricted, not only, of course, to women who live in restricted states, abortion is now no longer a right, but a privilege to those who live in 20 states who have chosen to protect that, or for patients who have means to access those states. What this has created is not just an issue for women in those states, though, but for women in California and New York, no matter where you live. For the reasons I think Dina mentioned, this isn't just abortion. This is miscarriage. This is ectopic pregnancies. This is embryos. There's so many healthcare issues that necessitate access to abortion services, and we believe integrating them into primary care is the way to do so. There's a massive supply gap facing women in America and providers in America. If every primary care provider in California stepped up and started providing medication abortion as part of their standard of care, just as another healthcare service alongside treating strep throat and pink eye and mental health and pap smears and birth control and all sorts of commonplace medical services that primary care providers do day in and day out, we could cover the supply gap facing the 34 million women in America who no longer have access to abortion services. And this is why we believe the future lies in abortion becoming a new part of primary care, and for employers to ensure that all their female employees have access to an integrated solution that is inclusive of abortion, but addresses women's whole health as whole people and not parts or a positive pregnancy test.
Yeah, thank you so much. Just a reminder for the audience that we'll be coming to you for questions soon, so raise your hand if you have one anytime soon. We'll be back. Dina, I know you have some thoughts on all the calls that have been out there for people to delete their period tracking apps. What do you think is fact and what do you think is fiction?
Yeah, so this has been sort of the aftershock, if you will, of understanding the reversal is a fear. There was a tweet that I think went viral on that was calling for women to delete their period tracking apps. There's still a lot that remains to be understood here, and I'm certainly not giving any legal advice, but we do need to be aware of the privacy implications here. And I think there's discussion that's happening in DC right now on this topic, and there's a lot of fear. But at the end of the day, from a legal perspective, it's all still up in the air. I don't think we necessarily need to be, deleting all of our period apps. I think we need to understand from a provider perspective what is covered by HIPAA and what is not provided, but also from a legal perspective what actually can be penalized and what can't be. And as Carolyn mentioned, it's not just about pregnancies and miscarriages, but primary care in general. There are many issues related, within women's health that are not specifically around the reproductive care cycle that are also at risk here, given this reversal.
Just to layer in there, I think the challenging part, though, is it's that much more important that women are body literate and deeply understanding things like their cycles or missed periods and things like this at this time when access to services like abortion is going to be increasingly more restricted. And so I think the legal situation is gray and hazy, and it's on us to give patients clarity by giving them access to comprehensive healthcare services that include navigating an increasingly complex legal environment state by state so that they can make informed choices day in, day out when there is a increasingly ticking time bomb that exists as a reality for women when it comes to making daily decisions in the context of their health.
Yeah, for the tech companies in the audience, what can they do to protect people who are seeking abortion care? What are their vulnerabilities when it comes to user data, things like location data, whether you're a company that directly deals with women's healthcare information like a period tracking app or something totally different?
Yeah, so I think there are already companies that have come out with statements around how they're making sure that they have a sanctuary for data and how they will protect, and there needs to be more of that. Employers in general are also stepping up and have been stepping up since the news came out to support their employees, and it's not just the women employees. I mean, this is an issue that affects all of us as human beings. There are men who will be affected by this, and especially in the midst of the great resignation that we're seeing right now, it is more incumbent than ever for employers to provide the care that families need. Abortion care is about health care at the end of the day. It's not an issue that should be relegated to a specialty provider or to a specialty cause.
Do we have any questions in the audience? And if you could just introduce yourself by name and company.
Sure. Dom again with Forge. I'm just curious, how is, this might be more for Carolyn, how like cross-border medical abortion, how is that impacting your business, or what influence? Because I feel like that's like a nexus that has yet to be hit.
Yes, thank you for raising this. It's a really important question because first and foremost, I want to acknowledge that there is no silver bullet solution to this problem. We believe it's going to require a lot of innovation, both from healthcare providers like TIA, as well as employers stepping up, as well as insurance companies stepping up to actually increase coverage for medication abortion and other services, nonprofits, policymakers. It's going to take a lot of efforts. With respect to medication abortion, which is a critical, let's say, tool in our toolkit that we know that can cover the vast majority of abortions in this country, if we're able to figure out how to safely and legally help women access them. Figuring out how women travel across state lines to get these services is one component. And we need to figure out how to protect the patients and the providers delivering this care. And so I want to call out California, who's been a real leader here in terms of passing protective legislation, both for patients who may be traveling from a restricted state, saying they can't be essentially brought back to their state or criminalized, but also the providers in that state. And as someone who employs hundreds of healthcare providers, I can tell you that this is a daily experience. My providers come to us and say, what can we do? Can I counsel my patients? What are my rights? Am I going to be criminalized? And until we can give our patients, our providers clarity about what they're able to do, they're in the business of delivering equitable, high-quality health care and helping women make decisions for themselves, but they need to understand what their legal rights are.
So can you send Plan B pills to a state that is illegal?
Plan B is not medication abortion,
Correct.
So you should clarify that.
Currently, telehealth regulation prevents providers from prescribing any drug across state lines. This is true for an SSRI, and it's true for medication abortion as well. There was a temporary regulation laxed, I think, certain laws with respect to cross-state line prescribing.
All of this is evolving so much,
Yes.
and including regulations that are outside of states as well. But Dina, I'd love to talk to you about how this is affecting digital health beyond women's health. Are there spillover effects of this decision into other categories of digital health?
I think what we're seeing is certainly some companies that may not have focused on digital health, or may not have focused on women's health more broadly in digital health, taking this on. One of our companies, for example, Carbon Health, is now providing care in this space. But the other point I wanted to make that I'd be remiss not to include is around the impact on underserved communities, and especially communities of color. Well before this ruling came out, we know that we are in the midst of a Black maternal health crisis. JAMA just released a report a few weeks ago on the impact on Latinx communities. Again, pre-reversal, we were already seeing an increase in maternal mortality rates. And of course, this is going to have an even more outsized impact again on those communities. Almost half the babies in this country are born under Medicaid. So although we've talked a lot about the impact, on employees and so on, there is a large percentage of the population that will not have access to that. And so I'm heartened to see companies that are stepping up to the plate, like Maven, who are launching in Medicaid communities for the families that need it most.
Absolutely. Well, Dina, thank you so much. Carolyn, thank you so much for sharing your views on this important topic.
Thank you, Emma.